My name is Kay Roberson. I live in Vancouver, Washington. I really like living in Clark County. It's family friendly, supportive. I've gotten a lot of support. There was a lot of abuse in my family. There was some physical abuse from my stepfather. There was just rampant loss, people, drinking. There was people that were just struggling to make ends meet. A lot of it was a survival mentality. I was married young. I think I was looking for safety, but we lasted 28 years. I had 4 boys. Those children, they were born into a family that was struggling. We were on Medicaid most of the time because the second child was born paraplegic, had spina bifida. Third child was premature. My son that had spina bifida lived 7 years. And there was a lot of help when he was alive. He passed away, and overnight everything changed. Basically, my mental health imploded. I was hospitalized repeatedly in the psych ward. When I would go to the emergency room, I was so ashamed of my mental illness and being on my mental health meds, I wouldn't tell the doctors that I was on those meds for fear that my care would change, their attitudes would change. I've learned now, my psychiatrist talks with my primary doctor, and my primary doctor and all of my specialists are all in the same building, which is great because when you go to see the specialist, he pulls up your records that your primary doctor has. And that's how the system should work. I started going to this church, City Harvest Church. I started meeting with this gentleman, and at first he came to the house, and our house was really messy. And he'd just scoot all the stuff off the table to set his coffee cup down, and he'd just sit in the middle of the mass and talk to me. And he would say things like, "You're valuable. You are a valuable person. You're important. Everybody's experiences is important, and you can use them for positive." So I've been working for Clark County Crisis Services for 10 years. The things that I teach the families and the consumers are all life lessons that I've learned. When I was struggling as somebody in generational poverty, it could have went on. It could have been, I would have passed that on as a heritage to my children and my children's children. And my oldest son is married. I have 5 grandchildren from him. My second son, he's had 2 children. He's the one that has schizophrenia. He's successfully living on his own. And he also has developmental delays and cerebral palsy, but he lives on his own. And I love my job. It's tough. It's hard. Some of the things you see are not pleasant. But what I love is the connections that I make with people who are totally suicidal. Because I lived suicidal for at least 20 years. And so I would tell them, hey, I get it. I did too. I had to make deals with myself. And at any given point in time, I had 4 or 5 ways to kill myself. And I had to just decide to live. And I make deals with people and say, you can always do that later. Let's try something different today. And I'm successful at being able to turn people around. But that's because you live it, that lived experience.